Thank you for asking me to come to talk today. I'm a speech and language therapist. I've worked in dementia since the early 90s, and I've recently started doing a PhD at the University of Manchester in semantic dementia, which is kind of a long-standing interest clinically of mine. And I'm funded by the Dunhill Medical Trust to do that work, so I'm very grateful to them. Sometimes people are a bit surprised that as a speech and language therapist that you might be working with people with dementia. You know, you can't get them better. What can you do? But I think we need to think about different levels that we might be able to focus our interventions around. So, for example, the ICF, the International Classification of Functioning, Disability and Health, which is a bit of a mouthful, isn't it, from the World Health Organization, looks at different aspects of where you might target those interventions. So you might try and modulate the disease itself, the semantic dementia. There might be therapies that you might try to practice skills like word finding, and that might have an impact on conversation. Or you might be interested in things in the environment, facilitators or barriers to people with dementia, in my case semantic dementia, or the issues that are personal to that person. So the therapies I'm interested in are the things to do with the communication environment, the people around the person with semantic dementia, and their coping styles and the coping styles of the person themselves. And that fits with a quite a dominant model in dementia care at the moment, which we refer to as the biopsychosocial model. So apologies to the people that came to the PPA support group back just before Christmas, because many of these slides are the same. Really, as Jennifer said, there's changes within the brain that lead to changes in functioning. But also, we need to think about people in the environment that they live, going out and about in society. So their behaviour is not solely influenced by their brain, it's influenced by other things in the environment. So, for example, it might be influenced by their reaction to their changes in functioning and the way they're treated by healthy others, other people around them, and then their reaction to that. So, for example, you might have two people with a very early dementia. Mr. A might have a mild word-finding difficulty, but his reaction is that it's not going to stop him doing things. He's going to go out and about. He's going to live his life, and he's going to get out there. Yeah. Another gentleman might have exactly the same performance on testing, but he might say, actually, I'm really concerned about my communication difficulties. I'm very aware of my word finding. I'm rather embarrassed by it. I've begun to notice when I'm chatting to my friends in the pub that I can't find the word, or I need more time processing things. A gentleman of ours recently is talking about when my friends are saying about names of people and places, it takes me a long time to process that, and the conversation's moved on before I get there. So, you know, actually, is it worth going to the pub anymore? Well, then he's at risk of social isolation, isn't he, if he stops going to the pub? So actually, but he's actually got very mild difficulties. So it's such a shame if he stops going to the pub. So whilst the difficulties may be the same, it might be about their reaction to that and how therapy and support can take account of that. And it might be support about coming to terms with the condition, recognising your limitations but also your strengths, what you can do out there in the pub, which parts of conversation you can take part in, and also about whether those people in the pub can support you in ways to help you engage in conversation. So here's another example. Mrs. D, a lady with semantic dementia, has some problems with word finding, and she's very frustrated by her word finding difficulties. Her husband tries to get her to think of the word herself, even if he knows what she's trying to say. So he kind of tests her memory. And her reaction to this is she kind of gets very frustrated by it. So an example would be she might say, so what are we doing today? And then he'd say, well, what day is it today? And she'd say, Saturday. So what do you normally do on a Saturday? I get the paper. Which paper do you normally buy? I buy and we can see her frustration rising. And she gets rather irritated with him. Now, is the cause of her distress her word-finding problems? Is it that she's feeling tested Or is it actually a bit of both? And they have different perspectives on this. She thinks he won't help her in conversation. You're not helping me out. And she feels on the spot. But he thinks he is helping her because he wants to keep her brain going. You've got to keep people with dementia stimulated, haven't you? That's what all the leaflets tell you. And you can't finish people's sentences because that's what the leaflets also tell us. So he's doing the right thing. So this issue is actually very difficult. When should you give somebody a word? When should you stimulate them? How much should you stimulate them? How much frustration is a good thing because you're thinking, and how much is a bad thing? So these all-day, everyday things are just all-day, everyday challenges for people living with semantic dementia and their carers. So for me, it's about thinking about ways to use and maximise functions and abilities. It's not necessarily about practising to get those things better, but it's about making sure that people use what they've got to the best of their abilities. And in the ICF framework, there's a distinction between capacity and performance. So it's thinking about what people are capable of doing versus what they actually are doing, and having a look at that, what that differential might be, and how we might all work with people with semantic dementia to help that. So in terms of everyday life, it's thinking about opportunities for communication. And we know that sometimes dementia of all types often means that people often say, well, you find who your friends are, for example. You know, are friends as supportive as they used to be? Are social contacts as forthcoming as they used to be? About challenges and support for the person, challenges and support for the carer, and providing the right support and information. And I think that's particularly crucial for all types of frontotemporal dementia, because one of the problems is that services are configured around a blueprint of dementia, and the blueprint that most services work around is Alzheimer's disease, isn't it? So there's this kind of general thing about people that forget, that might be confused, that might benefit from reminiscence. And so a lot of the strategies that we use are surrounding that blueprint. And so people are given information arising out of that model. So sometimes there's potential for misinformation. And I've certainly sat in carers groups, and there's been like the 1 or 2 people with FTD, and people have been given the wrong information because they've been given information derived really from Alzheimer's. So it's not just about information, is it? It's about the right information at the right time, and trying to think about that more deeply, really. And it's also about this recognising and balancing needs, and this is a difficult one, isn't it? I mean, dementia goes to the very heart of this. Constantly, all day, every day, people are balancing individual needs, aren't they? The needs of the person with dementia versus the needs of the carer or the family members. And this has been called like contested territories of everyday life with dementia. So the example about, should I let my husband go out because he's dangerous on the crossing, is an example of a contested territory of everyday life. At what point should you stop them? If I stop them, will it cause more problems? Will he be distressed? He's getting exercise when he goes out. So, you know, the notion, I think, as well, sometimes in frontotemporal dementia, we concentrate on kind of big behavioural issues, but all day, every day, there's these small, little, contested territories of everyday life where you may be pulling in different directions. So the research I'm involved in is looking at an intervention for people with semantic dementia. We're trying to develop and refine an intervention. And we're using conversation analysis, so people are very kindly taking little camcorders and they video themselves talking at home. And we're using narrative analysis, so interviews, looking at things that are very relevant to that person, photos, music, objects, some cognitive assessment and clinical reflection. We're working with a small number of families to describe the kind of communication challenges that are there at home, the sort of strategies that seem to help, and then looking at how we can build on those in terms of a kind of therapeutic model. And so this kind of research is perhaps different to what people might traditionally think about research. So we work with a small number of people, but see them very intensively. So the people in our research, I've been to the house between 10 and 20 times with some people. So it's really trying to get to understand their very individualised needs. And that's the point of it, is understanding the individualisation rather than averaging out with a larger number of people. So this is qualitative research. So some of the themes that are coming through from the families, this is from a pilot study we did, but these sort of themes seem to be coming out in our research with a larger number of people. And Jennifer's touched on these before. Living with routines, policing and protecting, making connections, and being adaptive and flexible. So people with semantic dementia sometimes find that they like to talk about certain things, repeated topics or phrases or conversational habits or routines in life. A gentleman with very early semantic dementia says to me, I just don't feel as flexible in my thinking anymore. You know, maybe doing the same things, wearing the same clothes. And what's interesting about this is it's thinking about how this plays out differently from the standard blueprint of dementia, because it's often an advocated strategy in caregiving that you should have a routine, that it helps you. But the problem in this is that the routine's the issue, the problem, if you like. And it's learning to live round that routine that's the solution for people with semantic dementia and their families. So that's the challenge. The routine is the challenge, not the solution. Again, that's very different from other kinds of dementia. And again, we're back to this pulling in different directions sometimes. You know, the person may feel that their routines make them feel very secure, whereas the family might think, I just would like some more spontaneity. You know, this is inflexible. Caregivers and family members talked about various problem-solving techniques. One lady said, I've only got 2 changes of clothes that he's happy with. So one comes off, it goes in the wash, and it's ready to put on the next time. Somebody else in our group said that we did some focus groups with speech and language therapists as well, I should have said on the clinical reflection. And somebody talked of a lady who got particular liking for a certain Marks and Spencer's skirt, and her daughter just went everywhere and bought her 10 of these skirts, so there was no issue. So there was a real sensible problem-solving thing. Everybody was happy, she loved this skirt, there were loads of them, no problem. So that's about living around your routine, isn't it? I think sometimes he's happy with a phrase, he can say that phrase, you know, seeing the benefit to that person. And one lady said they'd had a very spontaneous early retirement, doing loads of different things, different days, going different places. But she said, I think the time's coming now where he needs a regular routine, you know, doing a certain thing on a certain day. All this doing different things was just becoming too much for him. And she recognised that. And I think it's about understanding the routine as a need. And I think staff in particular have a bit of a problem with this. You know, one of the speech therapists spoke about a lady who always listened to a certain radio programme at a certain time of day. And other members of the team couldn't understand that you could not visit at 10:30. You know, you just couldn't go then. She wouldn't answer the door. Well, that's the only time I can go. Well, tough. She won't answer the door. It's not about your need, this is about her need, and if we're supposed to make services responsive to individual needs, you can't go at 10:30, end of. So this is Reg and Sarah, who are in our study, and Reg was shaving in his sink, and Sarah's got this habit of having a mouthwash, and she wanders around with mouthwash for quite some time, and she spat it into the sink while Reg was shaving. And Reg said, I said, why don't you put it down there, the toilet? And she said, well, I've always spit it in the sink. And it's that fixation of what I have to do all the time. And I said, well, you shouldn't do it like that. And then, of course, she went, I've always done it like that. And then there was this bit of an argument starting, but it's like set in stone. If you like, she must do what she must do in her ways of doing it. And he spoke about how he'd learned to kind of live their morning routine around the things that she needed to do. Whereas early on, he tried to thwart that or change it or make her fit in, but he realised that was not the best thing for either of them. And also that it wasn't deliberate. I think in a sense, some of the terminology is slightly unfortunate. You know, when we think about inflexibility, because it kind of sounds a little bit judgmental, doesn't it, that we're deliberately, but actually it's, I think as you said, it's not that people are deliberately doing that. It's that that's their way of hanging on to what they're secure with. So it's about security, really. So policing and protecting, constantly vigilant to keep an eye on what the person's doing or saying in order to protect them or others from the consequences of behaviour or actions. So around the home, it might be in activities to keep the person safe, or during activities to help if the person had a word finding problem, or make sure that what they said was appropriate to the context. So almost this like hyper alert state, which is why it was so tiring, you know, constantly thinking about you, but constantly thinking about the person you were supporting. And in the early stages, it might be very subtle. One lady spoke about being at a party and how she felt like she needed to kind of stand with her husband in case he had any word finding difficulties. But then she said, well, my friend came over and said, for goodness sake, he's okay with Bill. Come and talk to us. And she took her off and left him with Bill. And he was absolutely fine. And she was very pleased that her friend had kind of made a move away from this kind of policing to make sure he could function. And he was absolutely fine. One gentleman said, now she'd do things she would never do before. She'll say things she'd never say before, as if she's got Dutch courage. And so that notion that you might have to intervene. Now this is it's interesting, the question, because this is I've got on my slide here. I want to go out by myself. It keeps me well. I'm just going to cross that road. And the care, but where will you go? What will you meet? Will there be a car? What will you say? How's it going to happen? Well, problem solving, think about what the issues are. Is it possible or is it desirable to stop the person? You know, we had a man with semantic dementia in our study, goes out on his bike very regularly. And the wife very worried that he might get lost or couldn't ask for help if he does. And so it was about exploring those issues. I mean, so far, he just cycles the same few routes. Once he's had a puncture and he just put his bike over his shoulder and walked home. So there's actually no issues at the moment, but carers often feel, at what point should I stop them? That's a big issue. Another gentleman went out to the shops and they live near a school, and his wife was worried because he was very friendly and he would make jokes and he'd talk to people, and she was worried that he'd talk to the school children and they might laugh at him, you know. So the way round that they found was she changed the time slightly when he went out, so the schools weren't coming out at his trip. But I think that there's an issue really about whose risk is it, and an issue of shared risk in this, because I think one of the problems is carers kind of feel that if that person gets knocked over, it'll be their fault, for example. You know, and I think we have to acknowledge that we're dealing with really difficult issues. And I think if services are going to support people, we have to have some shared ownership of exploration of risk and looking at the positives and negatives. So carers don't feel that is somehow on their back if that person comes to harm. So I think it's about supporting people within that. We've looked at using individual budgets to support people in their routines, to take people out. Some dementia environments, dementia cafes, for example, some people find them very supportive because it's an understanding environment. They don't feel they've got to constantly police the person's interaction. It's just a safe place to be. And this issue of when to argue and when not. One of our carers said, well, if it's of no use to me or her, and that was his bottom line. So it had to be of no use to him or her, and that's when he'd argue. And I think that's quite an interesting, insightful comment, really. Cards to explain the condition was things people had. And for carers, things like, and again, I think this is slightly different from other forms of dementia, exploring emotional responses in situations. I mean, I've taken people with semantic dementia out to the shops, to cafes. I don't get embarrassed by any, you know, sometimes people are very friendly, and I think that's very nice. But actually, if that was my mother or, you know, my husband, I might feel very differently about that. So it's an emotional response. So I think when we look at the communication literature, one of the problems is it's almost like it's some techie, a technical endeavour. But for people living with it, it's an emotional issue, isn't it, as much as anything else. Another theme was making connections. And this was, you know, really trying to keep the person in contact with the social world. And people spoke about challenges with understanding or finding words. The thing I think people also spoke about, which is less in the literature, was a lack of conversation. So she's not one really for kicking off a conversation anymore or anything, unless certain things come into her mind. So at points, sometimes people being very talkative about certain things that were particularly important to them, but other times being really rather quiet and hard to engage. One thing that actually is quite interesting in the videos, looking at videos of people at home, when you're testing people, it's really obvious when somebody fails to understand something because they don't point to the right picture, or quite often they repeat words back. Monkey, monkey, which one's the monkey? You know, and you're not quite, you know. But actually sometimes in our videos, we see instances where people do things like they go, yeah, like that. And the carers say, I'm not sure if they're not interested or they've not understood. And sometimes when we've shown the videos back to some of the carers, they said, you know, one lady said, do you know, I think he's just not understanding what I'm saying. I think that's what it is. It's just not going in. So sometimes it's not just about, I think in context, sometimes difficulties are harder to see. The traditional focus on communication has been about conveying information between two speakers and two speaker hearers. But I think that misses the value of interaction itself. So Heidi Hamilton's a professor of linguistics, has done a lot of work in dementia. And she says interaction's like a dance, a co-constructed process rather than a product itself. And I think that's a really nice analogy. Because quite clearly, not all dancers are equally matched, are they? But a good partner can get you a long way. And here we see John Sargent dragging his partner down across the floor like a sack of spuds, and poor Anton, really, what can we say? But I kind of like the dance analogy, because I kind of think, do you have to be good at something to enjoy it? And I think that was the first lesson I learnt moving from I'd worked with people with stroke to work with people with dementia, is to think beyond whether people could convey information from one person to another, but to think about, could people still participate and enjoy conversation despite their communication difficulties? And carers in our studies doing all sorts of things, you know, showing the person what they mean, doing life story work with photos, objects, music. One lady had an iPad, and when he didn't understand, when she said asparagus, what's asparagus, she Google imaged asparagus and showed him. Nice little strategy. People talked about less activities where there was less pressure on talking, going to bingo, cinema, going out to music, and communication would happen as a byproduct, but there'd be less pressure to talk for both parties, and obviously peer support. The speech therapist said they were doing all sorts of things with people. People with early semantic dementia using key fobs with names and information on. One gentleman that was still at work that needed to know certain things, they used that. Lots of scrapbooks and life story books. One lady had a real interest in Elvis Presley, so they made a book about Elvis Presley, and she absolutely loved looking through that and talking about Elvis Presley. That was her relevant thing. Notebooks and diaries, shopping lists with people's own labels on it, operating instructions for televisions or videos that had changed to keep people engaged, really. One gentleman used a visual timetable. If you said to him, it's Monday, you're going to the allotment, he wouldn't know what that meant. But if you said, it's Monday, you're going to the allotment, the gardening group with Jackie, and showed him the photo, he'd know what you meant, yeah? So this kind of enriching what you said to help somebody understand. I think non-verbal communication's important. I think we focus on verbal communication, but non-verbal is also important. One carer said, you can tell by looking at her when something's not right, or she's shocked or something. And the lady says, what? And I said, you can always tell with your face how you feel. Ugh, she says, and pulls a funny face. And we all laugh. It was very funny. And I said, do that again. And she laughs and pulls a different face, and we all laugh. And you can see there's absolutely no information exchange, but it's a really nice point of connection between us. And I think it's really important to think about points of connection. We studied a gentleman quite in depth who is very good at doing what we called enactments, so performing things. And we've avoided using the word gesture when we describe this, because there seems to be a pervading view that people with semantic dementia can't gesture, as somebody was telling me when I was presenting this at the FTD conference. Well, I can tell you now, people with semantic dementia use all sorts of body movements to convey what they mean. And that's very different from pantomiming objects that you might look at in test situations. So in our research, we've had machining, we've had driving, we've had swimming, we've had piano, we've had golf. So these are things people like talking about. They're their personal stories, if you like. And this guy's very good at that. He uses just over there size things. When he talks about going for a walk, and we went and it was dum 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 to show that it was windy and it went down. So or we went whoosh when he goes out for a walk. Now, if I said it was and I just swoosh swoosh and it was, is a typical empty utterance, isn't it? But if I contextualise that, we're standing on the doorstep and I say, did it snow here? And he says, it was. And I just swoosh, swoosh, swoosh. And it was. So the context is quite clear. It snowed, I swept it apart, and it was fine. So I think if we decontextualise speech, we kind of do people a little bit of disservice. So actually sometimes in context, pointing is very important. If I go in a cake shop and say, I'll have one of those, it's very empty, but I get the right cake, don't I? So it's not just words. People talked about the value of human contact, that touch, visual things, keeping in contact in different ways. Now, one of the things people did talk about, and Jennifer's mentioned this, Sudoku and jigsaws. Now, one of the problems, though, people said about that was that they were quite solitary activities, that people could be doing them for quite extended periods of time. And there was a bit of concern that actually then people then became a bit disconnected while they were doing those tasks. So those things had a benefit, but there was also a downside to those, and that's one of the things the carers spoke about. Sometimes people said that they capitalised on people's love of number by taking them to the bingo. One family talked about never been to the bingo in their lives. A family member that really liked bingo took this gentleman to bingo. He was really good at it. He really liked it. They went for a meal afterwards. It kind of capitalised on his abilities, but gave them something positive to do. So I thought that's a really nice example. Lastly, being adaptive and flexible. This change in behaviour, people's likes and dislikes, the programmes that people watch, their social behaviour, finding practical and psychological ways to adapt to those. And actually, people often said we've had to learn ourselves. No one seems to know what to do for our day-to-day problems. And sometimes people said they were given conflicting advice. So sometimes people were seen by they went to voluntary agency services where they were given advice. They were given advice from psychiatry services, and then they also went to a, tertiary memory clinic. So there was potential for different advice from those different services, and then they had to reconcile that. Or a lack of advice around what to do about these little everyday issues, and that was what was concerning. So, one gentleman had never liked dancing or singing, and we said, we were trying to get him along to this one of the clubs because we thought he might like it, and he spent all day dancing and singing, and he really enjoyed it, and his wife was just perplexed. What, you? And I said, would he ever dance before? Never. What, never ever? Not even when he's had a few drinks? Never, Jackie, never. So she was amazed that her husband was really liking this. So actually, in terms of services, this gives us a bit of a challenge, because in that blueprint of dementia, we often use people's previous interests to plan what we're going to do. Now, if there's a change and people no longer like rugby or football, but they now like dancing, we've got to be able to react to that and adapt to that as services, really. So one son said 10 years ago he'd have hated that programme. He'd walk in and walk back out again. Now he couldn't stop talking about it. He really loved this change in programme. And so there's this discontinuity between past identity and present identity. So it's not a loss, it's a change. And that, again, is something different in terms of the narrative of these different kind of conditions. And so I think that's hard for families to plan around, and also for services in terms of provision. One gentleman talked about having his wife had everything out in the bedroom. When you go in there, she's literally got everything out in the bedroom. And he said, Well, he kind of thought about putting it all away, but actually that's the way she really liked it. And she liked, she had almost like baskets of different things, her brushes, her deodorant, you know, and she had her clothes on a rail despite having a wardrobe to put them in. So I said, well, maybe there's some security in being able to see all your things. And he said, I think you're right, it is. I suppose what you've done is you've prioritised the fact it gives us security over arguing about putting them away, haven't you? And he says, yes, exactly. And I think maybe if she did put them in the drawer, she'd forget that they were there anyway. So some sense of seeing a reason for it. And I think this is so important, isn't it? It's about trying to understand what benefit there might be to that person in doing that and why you might live around that in order for both of you to survive, really. So I think we need to understand more about the everyday experiences of living with semantic dementia and all kinds of frontotemporal dementia, really, from both perspectives. I mean, at this stage, we're looking at the narratives from the people with semantic dementia, because I think that's a real gap, because we're often very focused on the experience of caregivers. And certainly all the people in our study in the early stages were all aware that they had dementia, and were able to give some description of what condition and how it affects you. One of our ladies actually says the husband quite likes teasing her, and she often turns to me and she says, is he teasing me? And I say, I think he might be. And then she turns to him and says, you'll excuse me swearing, no wonder I've got bloody dementia if you're treating me like that. So she's very aware. So this notion that people aren't aware, I think that's a narrative we really need to unpick more. And it's about sharing what keeps you going and what works, and more research I think we need on these little everyday strategies, what to do about this, what to do about that. Thank you.